Because Pap test results can be impacted by the presence of non-cellular materials in the transformation zone, it's important to advise patients to refrain from sexual intercourse, avoid vaginal medication, personal lubricants, vaginal contraceptives, and douches for 48 hours prior to the exam. Likewise, it's important to avoid scheduling the appointment during menses. Position the patient and insert a speculum into the vagina. Warm water may be used to lubricate the speculum. If the patient is uncomfortable, a small amount of water-soluble, carbomer-free gel lubricant can be applied to the posterior blade of the speculum. Hologic recommends use of carbomer-free lubricant because lubricants containing carbomers may interfere with the Thinprep Pap test. It is important to remember to use only a dime-sized amount of carbomer-free lubricant. Apply lubricant only to the exterior sides of the speculum, avoiding the tip. Perform a brief visual examination of the cervix. Remove excess mucus or other discharge present before taking the sample. This should be gently removed with ring forceps, holding a folded gauze pad. Cells will be collected from the squamocolumnar junction, or transformation zone. This is the area where the endocervical columnar cells merge with the ectocervical squamous cells, and it is also where most dysplasia develops. Cervical specimens can be collected with a brush-spatula combination or a broom-like device. When using the brush-spatula combination, start with the spatula, which is designed to contact the ectocervix only. Select the contoured end of the spatula and rotate it 360 degrees around the entire ectocervix, while maintaining tight contact with the exocervical surface. Next, rinse the spatula in the Thinprep vial by swirling the device vigorously at least 10 times. Next, use the brush to obtain adequate specimen from the endocervix. Insert the brush into the cervix until only the bottommost fibers are exposed. This increases the likelihood that the brush is contacting the full transformation zone, even if it is not visible. Slowly rotate 1/4 to 1/2 turn in one direction only. It is very important not to over-rotate the brush. Studies have shown that turning the collection device more than 180 degrees does not increase cellular yield and may cause bleeding. Rinse the brush in the same vial used for the spatula. Rotate 10 times while pushing against the vial wall. After rotating, swirl the brush vigorously to release additional cellular material. The broom-like device is designed to contact the ecto and endocervix simultaneously. Collect the specimen by inserting the central bristles of the broom into the endocervical canal, deep enough to allow the shorter bristles to fully contact the ectocervix. Push gently and rotate 5 times in a clockwise direction. Immediately rinse the specimen into the Thinprep vial by pushing the broom against the bottom of the vial 10 times, forcing the bristles to bend apart. Next, swirl the broom vigorously to release additional cellular material. Thank you for reviewing the Thinprep Specimen Collection Protocol. To learn more, please visit thinprep.com.